Hello and welcome to the What's New webinar with Justworks, where we will be talking about a number of new additions to our health offering here at Justworks and some really exciting investments we've made in our in-app experience to help our customers navigate this year's renewals with confidence. So as a disclaimer before we get started, this material has been prepared for informational purposes only. It is not intended to provide and should not be relied on for legal or tax advice. If you have any legal or tax questions regarding this content or related issues, then you should consult with your professional legal or tax advisor. To introduce myself, my name is Julia D'Amico. I manage our health initiatives here at Justworks, so I spend time understanding the health benefits landscape and our customers' needs and help Justworks spot meaningful places to invest in order to create a cohesive experience that resonates with the modern health consumer. And I will hand it to Amy to introduce herself, who will be the real star of the show today.
Thanks so much, Julia, and thank you everyone for joining. My name is Amy Cushman. I am our program manager of benefits here at Justworks, and I'm responsible for managing all company-wide large-scale initiatives. So I'm currently focusing on this year renewals, but I'm also responsible for making sure that new partnerships and new launches feel like one cohesive experience, both internally for our teams and also externally for all of our customers. So what we're going to cover today, we're going to talk about new plan offerings. We're going to talk about the updated plan selection experience that Julia mentioned. We're going to talk about some adjacent health services and also address some of the recent regulation changes. And then thank you for your pre-submitted questions. We've chosen a few of those to answer, and then we'll wrap things up.
So to kick things off, as Justworks continues to service more customers and also as our customers grow with us, their needs, priorities, and constraints surrounding health insurance change. So Amy, can you give us an overview of the new plans that we're offering through our carriers this year?
Yeah, I'd be excited to. So this year we're offering 4 new Aetna plans. I want to call out this $2,000 deductible, high deductible health plan. This is a great low deductible plan that also is still compatible with an HSA. It is non-embedded, meaning that if you're going to enroll family members on this plan, everyone is subject to that $2,000 deductible, but it still might be a great option for you and your family, or it might be a really great option for you as an individual. We offered some of these higher deductible plans with lower coinsurance to make sure that we are providing more affordable options to all of our customers this year. And then this $6,350 deductible plan is one of our plans that is both a POS and a PPO flex plan. So if you have employees in states like Idaho or Missouri where they might need to access the POS network, or the PPO network, this would also be a new option that you can add for those employees. We've decided not to sunset any of our Aetna plans this year. This is to make sure that there is total optionality for our customers to figure out what is the right plan and what meets their employees' needs. So we're keeping all of the current plans that we already have. In addition, what's really exciting is all of our customers who are located in California, but also ones who just have employees in California, are automatically going to be offered all of our California HMO plans this year at renewal as an opportunity to offer those to your employees in California. For our United Healthcare plans, we did decide to offer a new plan this year. It's a $1,500 deductible, 90% coinsurance traditional choice plan. This is one of the richer offerings that United Healthcare provides to PEOs, and so we're really excited to be able to offer it. We did choose to decide, we did decide to sunset 2 of our plans this year. We sunset both U13 and U14 based on the low enrollment in those plans. They were both $3,000 deductible, 80% coinsurance plans. But if you were offering one of those plans, there's no need to be concerned. We do have another $3,000 deductible, 80% coinsurance plan, which is U15, which will be made available at renewal. We are offering United Healthcare to new customers in Colorado, Arizona, Washington, and Illinois currently. We are exploring market expansion for our United Healthcare markets, so definitely stay tuned. As soon as we have more information on where we might be expanding, we'll be making sure to let you all know. For Kaiser, we were able to offer 2 new plans. These were plans that we heard feedback from our customers who are currently offering Kaiser when they come to us, or those who have had Kaiser in the past. We're going to offer the HMO 30 plan in all of our regions except for California and Hawaii. In California, we have the richest offering, which is the HMO 20 plan. So now you'll have something comparable if you have employees in another Kaiser region. And then across all of our regions, except for Hawaii, we were able to secure this mid-range $2,000 deductible plan that really rounds out our Kaiser portfolio. And then in addition, this year at Renewal, if you have at least 5 benefits eligible employees and you're located in one of our Kaiser markets, so Oregon, California, Georgia, Virginia, Maryland, or DC, you are automatically going to be given the option to add a Kaiser plan if you so choose and if that feels right for your company.
Great, thank you for that, Amy. And as we know, admins face this really big decision around which plans to offer going into the new plan year. And it's a decision that looks different at every company and one that can, quite frankly, be pretty daunting without the right context and control. So Amy, can you give us a tour of the new features and functionalities that we're rolling out this year to help employers make those decisions?
Yeah. You're right. We completely redesigned the way employers pick plans this year. We did it with the idea that we wanted to give our customers as many options as possible. So when a customer comes in to pick their plans, they'll get a sense of their requirements based on their specific company's size and location. And then we're showing them all their available plans. They can roll over certain plans to see what might be incompatible with one another. The plan cards are pretty detailed, and we've even expanded them to show more high-level information. Of course, you can always download the plan details if you want even more. We added these filters on top to help customers narrow down what they're looking for. In this case, I've put on an HSA compatible filter and have gone ahead and added a plan to my cart. There are other filters available. We have a filter by network type. So maybe you're really interested in those California HMO plans and you want to find one that fits for you. You'll notice that here we're highlighting that this company has employees where this plan won't be available to them, and it tells you specifically who those are. So as you're making decisions, we're letting you know whether or not that's going to be available to all your current employees. We did this because in our previous experience, we had groups that were pre-selected for our customers, and we just found that lots of our customers want to be able to pick plans that maybe don't go in those groups. And they want to be able to find things that specifically meet their needs and the needs of their employees. So we've put some guardrails in place to make sure that the plan offerings go well together and that every company is meeting their requirements, but really we're trying to turn the control over to the customer this year. So once you hit your requirements and hit save, it'll put those plans in your cart and bring you back to your dashboard. The other thing that we've done, which I am truly so excited about, is we've completely redesigned the way we show customers their renewal. There's a couple things to offer here. We're calling this the Renewals snapshot. So when a customer begins plan selection for renewals, what they're going to see is this high-level summary of what the company is currently spending on health insurance premiums. We're basing this off of their current enrollment and what plans they're offering and the prices of those plans. And then we're telling them, if you kept everything the same, all your employees enrolled in the same plans, they enrolled their same dependents, here's what you could expect to spend in the new plan year starting in November. And it's a really great way to frame this idea of an increase for our customers because they get a good sense of what they're currently spending, what they could expect to spend if everything's the same. And then ultimately, if that doesn't feel right for them, of course, they can go through that plan selection experience you just saw. the snapshot will have a plan breakdown for every plan that the company is currently offering. It's going to compare rates side by side. So what are the rates that your company is currently paying for this plan, and what are the new rates that start on November 1st? On each plan card, you'll also be able to see the number of employees enrolled and the tiers that they're enrolled in. So that'll give you a really good insight into which plans your employees value. You might find that you have plans that no one's enrolled in, or you might find that you have plan favorites, if you will, and that might help you figure out what you want to offer to your employees. The plan cards also have a function where you can compare year-over-year changes. There's a link on the bottom left-hand corner of each card. If you click that, it'll bring up some high-level details of the plan that you're currently offering and the new plan. So you can see if things like out of network coinsurance or deductible or anything like that has changed about the plan that you're currently offering. And so that's readily available as well. And then as you can see from this, picture, if everything makes sense and it looks good to you, you can just click keep the same plans, and it'll just go ahead and cart those, and you can move on to looking at dental and vision if you want. If this doesn't feel right, you can go to switch plans, and you'll be brought to that experience we just highlighted in that video.
Amazing. Well, I am really excited to see that take flight and to see kind of all of that hard work get into our customers' hands. So also just knowing that taking care of yourself and your team's needs requires more than just great health insurance plans, and that what truly helps employers stand out from the rest and show their employees that they care are the health benefits that are not normally included even in the best insurance plans. So Amy, what do we have in store this year?
So I'm really excited to say that after releasing Talkspace to a small subset of our customers, we've decided to roll it out to everyone. So 3 months of Talkspace will be included for free for any employees enrolled in medical plans through Justworks. The Talkspace offering is going to run from November 1st through October 31st, just like our current plan year. We chose Talkspace for a variety of reasons. When it says therapy on your time, that means that you can write your therapist at any hour of the day. You can set up a call with them. You can figure out what makes sense. One of the struggles right now of people getting access to therapy is like being able to find an appointment that isn't like 2 p.m. on a Tuesday. And Talkspace really makes it so that you can talk to your therapist like when you need to, truly on your time. They also have over 5,000 licensed therapists available, and they're fluent in over 30 languages. So they do have high quality and certified providers available. And then there's the smart and easy matching component. So with Talkspace, when you start, you can sort of put down like what it is that is troubling you, or maybe you don't know what's troubling you and you just want to explore, but there's a questionnaire that you can fill out. And then Talkspace will take that information and say like, hey, here are some therapists that we recommend. They specialize in these things. Do any of these look like a good fit for you? If they don't, you can get another round of therapists. If you try one out and they're not a good fit, you can go through that process again. So it's a really great way for employees to say, here are what my needs are. Here is the time and place I want to communicate with this person. How can you help? And Talkspace is really taking all of that into account and providing that experience. So I'm really excited, again, that we'll be rolling that out to everyone. It'll be 3 months included for free for any employee enrolled in one of our medical plans. The other thing I wanted to highlight is One Medical. So currently, right now, we have One Medical available for free for all of our customers who are providing access to medical, dental, and vision policies through Justworks. What we were able to do is offer One Medical at a discounted rate to all of our customers who are on basic, or in other words, are not providing access to medical, dental, and vision through Justworks. So maybe they're not providing it, or maybe you're providing it through small group or somewhere else. Your employees will now have discounted access to get a One Medical membership available to them through the 2020 year. And if you sign up before the end of 2020, you'll have a year-long membership. So whenever you sign up, that's when the membership starts, and it goes for another 12 months. One thing I do want to highlight is that One Medical has rolled out One Medical Kids. So you can now get all the great benefits that you do as an adult for all the pediatric needs that you may have. One Medical is great. I use One Medical. I love One Medical. They are available virtually 24/7. And obviously that has been so amazing to have access to that in these times. And, you can make a same day appointment anytime. They have, tons of locations. I just really love them. And so the idea that they're expanding to allow families to access them for, pediatric care, wellness visits, same thing, any child can have a 24/7 visit virtually is really amazing. And then the last thing is that One Medical's Healthy Together program is the program they have that's going to help employers navigate bringing themselves and their employees back to the workplace in the era of the coronavirus pandemic. So we will also be partnering with them for that. And so that means that, our customers will get access to their clinically vetted evidence-based programs to help employees navigate how to go back and re-enter into the workplace. They'll have turnkey employee communications. We'll also get access to their COVID-19 screening tools, as well, of course, as access to care and testing for the coronavirus. And they also have new mental health resources and new virtual programs that are going to be available as a part of that. So definitely stay tuned. We'll be releasing more information as we start to roll that out. But we're really excited to be able to work with them and bring this to all of our customers.
Amazing. I also love One Medical and talk about it maybe excessively, but especially their virtual care has just come through on so many occasions and been so handy even before the pandemic. So now even more so. Taking a little bit of a right-hand turn, Amy, every year we know that government mandates happen at both a federal level and also at a state level. So can you give us an overview of what customers can expect regarding some of those regulatory changes from the past year?
Yeah, I'd be more than happy to. So, Julie, as you mentioned, mandated coverage comes in a couple forms. Sometimes it's done at the federal level, sometimes it's done at the state level. A really good example of this that I think people are familiar with is the Affordable Care Act's mandate that if you are 26, you can still stay on your parents' health insurance, right? And so that got applied to, all plans and coverage and carriers. And that's a really great example of mandated coverage. So our Aetna plans are based out of the state of New York, which means they are subject to New York state mandates. And this year, on January 1st, a couple mandates went into effect that are going to go into effect for our policies starting November 1st, once we've renewed, of course, after the mandate. So there's a couple things I wanted to highlight. So our Aetna plans, excluding the California HMOs, are now going to have additional comprehensive fertility benefits. So they're going to include advanced reproductive technology, 3 cycles of IVF in a lifetime for a member. They're also covering egg freezing and sperm freezing in certain cases. And so this is great news. These will be going into effect on, again, all of our Aetna plans except for our California HMO plans starting November 1st. We also partnered with Health Advocate to create a resource for how to navigate that coverage as well. So if you have any questions, you can certainly reach out to them, or you can reach out to Aetna's infertility unit and register with them and get access there as well. The other thing I wanted to mention, which went into effect January 1st, and is actually already a part of our plans, but I think it's worth highlighting, is that the HIV medication PrEP is now being covered at 0 cost to our members. So the carrier is taking 100% of the cost of that medication and will continue to do so. So that is a benefit. That is certainly staying through our renewal, of course, as it's mandated by the state. And so that's another really great benefit of having our plans be here in New York. The other things I did want to touch on, because our customers have reached out about this, is some of the other recent regulatory updates that happened on a federal level. So the first thing I want to highlight is the recent Supreme Court ruling on contraceptives. The ruling allowed employers to opt out of the ACA's contraceptive mandate on moral or religious grounds. But the ruling specifically applies to employers that are also the health insurance plan sponsor. So in this case, it's unique because we as the PEO are actually the plan sponsor in this case. And so, we serve thousands of companies across the United States. And our insurance carriers plans will continue to provide coverage for contraceptives for any person who needs access to them. So that there's nothing about our plans or our carriers plans that are changing in terms of the ability to access contraceptives. The last thing here is there was a recent update. The healthcare rights law is Section 1557 of the Affordable Care Act. It is the law that specifically prohibits discrimination against people based on race, color, national origin, sex, age, disability. And there had been a provision that transgender members were specifically included under the term sex. That was recently reversed. We, upon figuring this out, reached out to all of our carriers as well as One Medical, Health Advocate, Teladoc, and asked, what could we expect, if anything? And, I'm very happy to report that everyone got back to us and confirmed that they are absolutely committed to the care and coverage of their transgender members, and that we will have absolutely no changes on what our plans cover, and that if anybody is having, any trouble accessing care, they can certainly call Health Advocate as well to navigate that process, but we shouldn't see any changes in the care and coverage for those members.
Perfect. So thank you for that overview, Amy. Moving into our last section, we are going to answer a couple of questions that were submitted ahead of time. We picked the ones that seem to be popping up the most. And the first one that I'm going to ask you, Amy, is what are the requirements for a company to be eligible for health insurance?
Yeah, so this is varied because it actually depends on what carrier your company is offering. I will say that there are some general requirements that really, come into effect across all of our carriers. One I can think of is there's a minimum number of eligible employees. So for example, on Aetna, you need to have a minimum of 2 eligible employees that are from separate households, so not 2 people on the same family. There are also for Kaiser and United, they have some participation percentage requirements. There's also some COBRA participation percentage requirements. That being said, we do have a really great Help Center article on help.justworks.com called Carrier Eligibility Requirements, and it breaks down in every single, for each carrier, every detail and requirement that a company would need to meet. So I do recommend that if you are looking for the specifics for the carrier that you offer or may be offering come 11/1, to go visit that Help Center article, and of course, reach out to us 24/7 if you have questions about that.
Next question that we got from our attendees was, how does the total number of companies on Justworks health insurance plans impact my individual company's rate increase?
Yes, so this question and also rates are top of mind for our customers. We sent out an email in June asking you all what is the number one concern on your mind, and many customers wrote back responding about their curiosity and interest in what the cost would be at renewal. So this is definitely top of mind. This is it's a great question. we did just actually publish a blog on how health insurance rates are determined, and it goes into great detail, but I will definitely give a high level overview. But of course, if you want to read more, I would definitely recommend you head over to our blog and read that. It's called How Health Insurance Rates Are Determined. So Justworks as a PEO is able to do a couple things. We can negotiate with the carriers for richer plans at fair prices. But there are other things that do impact the rate increase of your individual company. So I'll break it into two parts. There are macroeconomic factors that go into your rate increase, such as how the economy is performing, how your certain geographical region is performing. It might also be that mandates have taken effect, or certain specialty drugs are rising in cost. And so some of those things definitely impact, not only, your individual company, but all companies, because these are just factors beyond, the specific company. But there are things that do, are impacted by your specific company. And so the biggest ones are what plans your company is offering. To be transparent, our carriers want to make sure that they're collecting enough premium to cover their claims. And the way you can make sure that that's happening is you can offer a diverse set of plans. So making sure that there are options in terms of cost and in terms of coverage, really helps make sure that your employees are spread out, and ideally can help mitigate against that. Of course, it's not a silver bullet, but it's definitely something to think about. And as you go into plan selection, something to keep in mind. The other thing that the carriers are really looking at on an individual company level is, the current plan usage. And then they're taking, hundreds of data points on how the plans are being used. And they're actually looking at the predicted usage of those plans. And so the carriers are really looking for these recurring, persistent claims. So something like, someone who might need a specialty drug, and it seems that they're going to continue to need that. They're looking at those as opposed to one-time events like the birth of a child. So when they're looking at predictive risk, they're looking at these persistent, recurring claims and trying to figure out how, based on how, members are using the plan today, how they expect to use them in the future. And so that's also, a direct impact of the individuals at your specific company.
Just a couple more here, Amy. Will you provide a clear comparison on coverage and ways to do some clear demographic analysis for plan selection this year?
Yes, I'm so excited. So on August 12th, the day before plan selection begins, there are a lot of resources that are going to be made available to our customers, but one of them specifically is our renewals guide. This year, our renewals guide is going to include comprehensive benchmarking data that covers, plan offerings as well as contribution levels from the employer side. So, on average, how much our employer is contributing. And we have this broken down by market, by company size, and in some cases, we also even broke it down further by industry. So, in addition to all of the other resources that'll be available, we're really excited to share this new benchmarking data and to put it in customers' hands and hopefully help them make better decisions.
Just to bring it home, one last question. Due to COVID, the number of our employees that require healthcare has dropped below the minimum. What are options that we recommend to still provide healthcare benefits to the single remaining employee?
Yeah, this is certainly a tough one. As I just mentioned in one of the earlier questions, the requirements to be able to offer health insurance are ultimately dictated by our carriers. And so in that sense, it's not exactly up to us. And so in this case, I would say that if you do fall below the minimum requirements, and you have an employee remaining, that exploring the marketplace or your specific state exchange is probably the best next step. I know that in some cases that can be daunting and it can be hard to figure out where to go outside of healthcare.gov. Our partners at Health Advocate are more than available to help someone navigate their state exchange, the open marketplace. They can also do things like financial planning, figuring out like what would you expect to use in health insurance this year and how does that compare to the premiums of your plan. So they're really there to provide a variety of resources if this employee does need to navigate those spaces. But that is what I would recommend. And I would certainly, I love health advocates, so I would recommend leaning on them in whatever questions that employee might have.
Amazing. So we are at time. I wanted to thank you, Amy, for taking us through all these insights, and to thank you all for joining. As we mentioned, the Renewals Guide will be available on August 12th, and we hope that you enjoyed. Thank you again.